Dr. Amber jumping on live talking about balancing hormones naturally. So I am discussing today how to help balance your hormones, the female hormones, looking at also how stress affects us, so your adrenal glands, as well as I'm going to throw some thyroid information out there. Whatever we can do to get you guys the information that you need. So one thing that I'll start with when it comes to handling the female hormones and really getting a good look at what is happening with the balancing of those hormones, it is gold standard. So when you go to the doc, or even I have also sent out for blood work to look at estrogen, progesterone, testosterone, looking at those hormones. But gold standard is actually saliva testing. So if you really want to know what your levels are, that is one really good way to actually take a look and see what your levels are so that we can help do the right actions naturally to fix that. So I always really like to reiterate the fact that even though people get blood work, which is fine, it's just that you have to get it often enough to really see, what the levels are, where saliva testing is a really easy, nice way, gold standard to look at those numbers. And here's the thing, unfortunately, insurance typically doesn't cover those saliva tests, but they're not that expensive. Once you've gotten the test done, then myself as a functional wellness doctor, I'm then identifying which hormones are low, which are high, which are on the fence, so that I can easily help to determine what we need to do with what I prescribe for female hormones not being balanced. So whether it be, dietary changes, I have creams that we use that are natural. I also have been known to use certain glandulars, so supplements. So supplements are really nice because a lot of times if people are on medications, supplements are food. So it's a really easy way to help support those glands to create an environment where your body will stop having symptoms. So some of the topics that I brought up when I put out what I was going to be discussing this evening had to do with polycystic ovary disease as well as fibroids. And just to kind of, let you guys know, when those conditions are occurring in the body, it's very rare that those individuals aren't estrogenic. They're not having an estrogenic effect, which means too many estrogens that are affecting their body. And so the goal really is to bring down that estrogen amount that they're exposed to. So whether that's through food or environmental things. So some things to note that some of the products out there that have estrogens, a lot of us use like anti-aging creams, different things to help our body that way. And a lot of times they have estrogens, but also what we eat. If we're not always eating meats that are not given extra hormones, right? They have their own hormones, but that they're not given extra hormones. You're then ingesting, whether it's chicken, beef, turkey, you're ingesting that extra estrogen. So that being said, you want to make sure that you are eating, if you're a meat eater, that you're eating meats that have not been given more hormones. The other thing is there's certain foods like soy, for instance. Soy is very estrogenic, and soy happens to be in a lot of different foods we eat that are processed. So that being said, when somebody has polycystic ovary disease or they have fibroids, it's a really good idea to lessen the amount of soy intake. There are environmental toxins that we're exposed to on a daily, and due to research, it shows that over a week's time, there's 82,000 plus toxins that we're exposed to. And I bring this up because, I'm gonna switch my chair around here. I bring this up because a lot of times, when we're trying to figure out, well, what is the exposure and why do we have this estrogenic effect? So sometimes we can't even necessarily pinpoint it. So really doing things with natural creams, natural supplementation, helping the body with it that way is key. The other thing is, of course, our cycles, depending on where a woman is in her cycles. One of the situations that Dr. Taylor and I run into with polycystic ovary disease is the tendency of having a hard time getting pregnant. And so there is a very specific way of eating that we suggest for an individual with that scenario, along with doing saliva spit test or blood work to then identify what we need to do nutritionally with supplementation and creams. Both for polycystic ovary disease and fibroids, doing an anti-inflammatory way of eating is super key. So what that means is lowering your carbohydrates, because those, not necessarily your fruits and vegetables, depending on what you're eating, but more so like breads, pasta, rices, different grains might play a factor. Chips, cookies, crackers, like those kinds of things, like you really want to bring those to a minimum, because everything you eat turns to sugar, and sugar is inflammatory, which it causes havoc on the body. So when you have these conditions going on, they cause, the condition itself causes inflammation. So you really have to watch what you're eating. Then other factors come into play. I'm going to shift for a moment to fibroids. When somebody has been diagnosed with fibroids, there are there are several different types of fibroids. And so that always becomes a situation for a woman to make a decision in regards to what type of treatment to look out for and what they might want to do. My biggest thing with fibroids that can occur is when they get big enough, you can have discomfort. You can have, discomfort even with going to the bathroom, whether it's a bowel movement or urination or with intercourse, but sometimes even just sitting causes discomfort because they're enlarged, they're inflamed. A lot of times individuals suffer with heavy bleeding, which then can make them anemic. It's a whole thing that goes with fibroids. And so the sooner that someone catches the fact that they have fibroids, the better. It is definitely at the beginning a lot easier to get a grip on than later on down the road when they're, the size of a grapefruit, let's say, which is common that can come into me. And part of the issue with it is because, when you're looking for fibroids, it's through ultrasound. And sometimes individuals, depending on where the fibroid is and the type of fibroid it is, they might not have pain or discomfort or even heavy bleeding. So they don't know for many, many years that this is what's going on with their body. But again, anti-inflammatory. So, the more fruits and vegetables you eat, obviously eating fruits in the morning, you burn that sugar easier. Having more vegetables on your plate rather than more carbs like potato, rice, things like that we'd have on our plate. Couscous even, different options, pastas that we might add to our meal, bread. You want to stay away from that. It's better to actually have more vegetables on your plate. And those are great antioxidants, so they're really good for your body at a cellular level. The thing of it is too, with both of these conditions, I highly recommend that people do like a liquid vitamin mineral. The reason for that is our soil is so depleted. We've turned our soil so much that the amount of vitamins and minerals that are in our soil are not what they used to be. Some of these studies I'm about to state are older studies, but I remember even 10 years ago reading a study where instead of being 2 peaches where a woman could get her vitamins and minerals from in the 50s, 1950s, now it takes 22 peaches. That's a lot of peaches. I forget exactly what I feel like the spinach, it was like a bunch of spinach, like one packet of spinach. Instead of being one, it was 3. So there's these studies out there that show that our fruits and vegetables have been depleted of minerals and vitamins, and so it's really key to make sure you're doing something along those lines. That also helps your body to cellular level. So, there's capsules, tablets out there. Capsules are better than tablets, depending on what brand you're buying, but really powders and liquids are the easiest. Mainly because when somebody's dealing with autoimmune, like polycystic ovary disease, that kind of condition, you really want to be able to give the body all it needs. So it's hard to get enough fruits and vegetables in. And usually that person has bloating, gas, irritability. They might be going between diarrhea, constipation even. They have major digestive issues. They're not absorbing as well as they could be. You remember your colon, your gut is absorption, utilization, hydration, elimination. So all of those things have to occur. And so when you're doing something liquid and powder, your body's absorbing easier. Many times with autoimmune disease, you guys have heard me talk about that I do gut repairs if that's what's going on. So besides eating an anti-inflammatory, low sugar diet, really jumping in and handling your digestive tract is also key. If you're having bloating, gas, irritability, you're going between constipation, diarrhea, but maybe you're only going and having a bowel movement every other day to a couple times a week. That walks into our clinic often. I think it occurs more than people are willing to talk about, but doing gut repairs is key with this as well. And the thing is with your colon, it's your second brain, so it really tells you how you're doing and how you're feeling. When it comes to balancing female hormones, there are tons of studies, especially with the Women's Health Initiative, which was back in 2002. That study in particular, but there's been many studies how chiropractic treatment helps the body function neurologically, which can help with PMS, it can help with hormonal imbalance, things that go with estrogenic, like too much estrogen symptoms, whether it be, headaches, cramping, body aches, these kinds of things. So kind of going back into just balancing hormones naturally, chiropractic adjustments are so key with that. This is the thing that's fascinating is the areas of adjustments that we do once we see that there's misalignments there, that occurs in not only the neck but the low back, which happens to control the balancing of hormones, but also your uterus, ovaries, and your colon. So to me, that's amazing. Like, your neck controls your colon. Your low back controls your reproductive organs and your colon. So you guys can imagine, we sit a lot these days. We're sitting to drive, sitting to eat. We sit on our phones. I have a great picture. My staff did it with me of someone on their phone versus someone just sitting. The amount of torque and pressure on that spinal cord is amazing. It's so dramatic. And it makes sense, like when you're going in fetal position and you're in that flex position, it makes it hard to even breathe, let alone function neurologically. So handling the neck, the upper back, low back, the postural component of that alone, but as well as where those nerve roots go is key to what I talk about. And, obviously being a chiropractor, I'm all about what we can do neurologically. And I talk about this a lot, but sometimes I'm not sure, if it's being heard. But when you get a chiropractic adjustment, it's affecting the front part of your brain, which is hormonal balance, it's digestion, it's sleep, it's how you feel. So when we talk about balancing of hormones and people talk about the ups and downs of that, the emotional components of things, nervousness, anxiousness, depression, things like this, in the scope of chiropractic, that side of our work really helps neurologically. Of course, there's many other things that can be going on that can be used as tools, but that's a really big part of balancing hormones. And as promised, I want to talk a little bit about the thyroid. I'm on this series of doing Facebook, live workshops, and thyroid's a big component because some of the symptoms I was talking about, like fatigue, also the healthfulness of your bones, right? A lot of people come to me talking about osteopenia, osteoporosis, talking about how you feel. Thyroid can be missed on blood. And when it is, people might be having symptoms of ups and downs. There's a specific name for that. And so when people are ups and downs, mood swings, there's also a condition that's even named by it, by those symptoms. And if thyroid's missed, it's like super key to understand that you need to address the thyroid. So because it's missed on blood, a lot of times, besides getting a full thyroid blood panel, I will do a test that's a temperature test where you wake up in the morning before you go, get dressed, go to the bathroom, have your cup of coffee, whatever you're doing. You literally right away when you wake up, you put the thermometer under your tongue, you take your temperature, and then you write that down. If it's 97.6 or below on average, meaning you've done this 3 mornings, you've done this 5 mornings to get what your temperature is, and it's 97.6 or below, that's when I'll jump in and say, hey, we need to do some supplementation. Sometimes people will say, hey doc, I'm already on thyroid meds. Maybe they have autoimmune disease, or they've been told they have a thyroid issue. So when this occurs, I say, no problem. Supplementation's like food, right? That's what supplements are. So you can actually take a supplement, which is like a food, to help your body even when you're already on medications. And then if the thing is like you're not at that point where you necessarily need a medication and we can do supplementation, that's great too. And just to kind of circle back on the polycystic ovary disease, along with talking about thyroid, realize with autoimmune conditions that, again, there is very specific way of eating to lower your sugars and inflammation, and that's a key part of you feeling better and having less symptoms, which is very important. So again, just to let you know, we do saliva testing to check for estrogen, progesterone, testosterone. I did my Facebook Live and went over adrenal hormones. That's also part of saliva testing. And then with the thyroid issues, besides getting a blood panel, we can do this temperature test to identify what needs to be done for supplementation. I have an amazing, it's called a metabolic survey that I do within my clinic when somebody has come in and they need help nutritionally. So that's a real big part of my first exam and consult. I also do a blood pressure test and a pupillary light test to check adrenals. For female hormones and adrenals, though, again, the gold standard is saliva testing. People ask me all the time what the cost is, and I never remember, but I actually happen to be doing several of these in the last week and had to help someone with the fee. The whole comprehensive test that I do is $325 for that saliva testing. Blood panels can be very inexpensive if we need to go that route. I like to do a comprehensive blood test, and that has a fee. We're with a co-op, so if if depending on your insurance, depending on the guidelines, they might not be giving you a comprehensive blood test, so we can offer that at a discounted price. You can always email me for that cost. We actually, so our consultations nutritionally, which I can do in person and I can also do over Zoom or phone, we do telemed. The initial fee is $200. And then after that, depending on what the program is, we bring our fee down. And so the reason I'm telling you this is a lot of practitioners that do functional wellness some of their pricing is very expensive. And so I find that we tend to be on the affordable side for people to get started and get on a program that's needed. Anyway, back to the balancing of hormones, right? So again, to handle symptoms, whether they're fatigue, whether it's, ups and downs emotionally, whether it's I can't sleep, hot flashes, night sweats, decreased libido, painful intercourse, really helping women get through these issues. There are techniques and protocols and choices, which is exciting, where someone doesn't necessarily have to choose, our modern methods, though there's time and place for all of that. Again. Okay, sorry, you guys. I'm on my phone and somebody is calling me. Anyway, like I was saying, if I can handle and help someone naturally, that's what I would like people to choose first, because then we can get you going in the right direction so we know the baseline. Again, though, just to empower you, if you are on medications already, as a doctor of chiropractic, I'm not here to take you off of meds or put you on meds, but I am here to do an evaluation to see how your body's functioning to get you the care you need through chiropractic and nutrition. So anyway, I hope this helps. I am actually in a space where I can see everyone who's watching. Does anybody have any questions? I can see if I can answer a couple questions before I hop off. Just to let you know though, moving forward, you can reach me on Facebook Messenger. You can reach me on Instagram Messenger. You could direct message me is what I mean. You can also reach us at info@voitenkowellness.com if you have questions. I am more than happy to answer those. If you are typing in a question at the moment, I want you to know that I go back in and I can answer the questions that you have, even on Facebook, if you are typing in questions and I can't see it right now. I'm pretty sure I have pretty good reception in here though. I'm trying to move into the rooms in my office where people can actually ask me questions. Anyway, that's kind of a whole overview on, different things you can do for polycystic ovary disease, fibroids, but also throwing in a little bit of the thyroid issues in here too. There are specific standards that we work off of that are gold standards in functional wellness, and they are so effective. I can't tell you how many people I've helped with those conditions, and I'm very passionate about it. I've been practicing 22 years. Balancing hormones naturally is one of my niches. So anyway, please reach out if you have any questions. I will be speaking again next month in November. It's not November. Don't speed it up. In October. And then after that, for November, December, we're taking a break, most likely on Facebook Lives. I will be, though, inviting people soon to webinars. So that's exciting for us. I like it because you guys will have slides. There's visual. I'm a visual learner, and it helps to motivate me. So we'll be having a lot more of that. And then just to remind you, we do have Voitenko Wellness Academy. So once a month in person, we do have different topics that Dr. Taylor and I talk about. Right now, she is, she's a Webster specialist, pediatric chiropractic. So helping women who are pregnant, trying to get pregnant, and babies all the way to 18 years old. So, dealing with scoliosis, sports injury, you name it. And Dr. Taylor's been doing a series of talks in regards to that realm here in the office. And then she'll do her Facebook Lives and her check-ins too. So anyway, a world of information. Please listen to what we have posted and saved, because it's great data and it can really help change someone's life. So anyway, thank you for spending this time with me. It doesn't look like anyone has any questions jumping out here. But again, if you think of anything and you're like, hey, what about this? Or you mentioned that, whatever it is, I go back and look, because again, sometimes I say that and then I get off and there's a bunch of questions. So anyway, looking forward to helping you guys. Again, info@voitenkowellness.com. We're located in Tustin. Our phone number is 714-730-2225. And nice seeing everyone here. I look forward to helping you in any way that I can, or maybe you're on for someone else and they need help. So please encourage them to reach out to us. Okay, great. Talk to you soon. Bye.